Okay, for section one of this video, we're going to go over some forms that we go over with clients, that we have for ourselves, and all that. So I'm going to get started here. First thing is an admissions form. So this is our check-in report, which I know is backwards right now. So this is for a dental that we're actually going to do today. So we've checked them in. We've got our internal ID up here. We've got the patient's last name, which is Pancrazio, and then we've got the patient's first name, which is Charlie, up here. We've got the date, which is 11/6. We've got that she is a canine. She's an Australian Shepherd. She is a spayed female, and she is 3 years old. As far as we can see here under our patient alerts, there are no medical problems. These are mainly just client concerns. Any issues, she's a little nervous, so it says go slow. She's very nervous. Our permanent patient records are on the computer, so I'll go over that later. Next on the list is the release and consent form. Surgery release form. This is for Charlie Pancrazio. Today we are doing a dental, 11/6. So what we've got on here is an option to do blood work beforehand, which we always recommend to our clients, just to ensure that they will be anesthetized properly and safely. For anybody over 7, we do require it as long as they didn't have blood work done really recently. So this is our Chem 10, so you get 10 chemistries in this, which covers all the blood work that you would need. Anything else that we're doing while they're anesthetized, we go over with the clients. So if we want to pull teeth and we weren't sure we were going to pull teeth, we either get a yes or a no, or please contact me first. We do any anal glands, a microchip, nail trim, or nail filing. They can select that there while they're under the anesthesia, and then we get a contact number and a signature from the client. And this just says that you consent to what we're going to do today. Gauge guard. It's pretty simple. Name of the patient, why they're here, if they have like a leash and a collar, L and C, and then the doctor's initials at the top, and then the technician's initials also. Laboratory forms, already went over that with the Chem 10. Anesthesia form. This is our anesthesia form. So up there we're going to put the date. We're going to identify the patient up there, what procedure they're doing, species and breed. Spayed female will go there, the age, the weight, and then the pre-exam would be temp, heart rate, respiratory rate, and the time we did it at. The rest of this is for the doctor, and then additional exam notes, and put their grade for the pre-surgical exam. Any diagnostic testing that we're going to do. So if we're going to do a Chem 10, we'd put it right there. We write it down. And then this is what drugs we're going to use. So any pre-medications would be put down here, and then the doctor will select what anesthesia form he'd like to use and put it down there. IV catheter and location, we write that down there. IV fluids and the rate. Endotracheal tube and what size, that's there. And then on the back is actually what we use for monitoring. So we've got date, patient identification, the weight, the veterinarian who's monitoring, all that good stuff. Procedure start time, procedure end time, anesthesia end time, anesthesia start time. So up here we have the IV fluids and rate, which is on the other side, but we like to have it on here too. So we like to put that down here, and then we just mark a plus if they are actually doing it. You got the times right here, and we've got all kinds of stuff along the side here with our symbols. So we've got the inhalant, anesthesia agent, so isoflurane is what we use here, so we always X that. We've got the pulse oximeter, right here. That's down here. Heart rate, respiratory rate, the amount of oxygen they're getting, CO2 level, and then blood pressure levels. And then we have to mark down for doing rebreathing, non-rebreathing, quality of recovery, time of extubation, all that good stuff. So that's our anesthesia form. And we've got discharge instructions. Okay, so this is an example of discharge instructions. So this is what we go over with the client. I'd say something along the lines of, your pet was under general anesthesia today. It's common for animals to be sedated for the next couple days. If they have more problems plus a couple days, give us a call back. If there were any incisions, that would be here, so we'd have to tell them about those. Any fasting, and then feeding a lower amount of food that day, and then feed softened food for 7 days in a dental's case. And then you want to restrict activity. Dr. Bleem has a specific instruction: apply MaxGuard topical treatment to the gum line every 3 days, or 3 times a day for 10 days. There's no lab work pending. And then we go over medications, so probably carprofen, and then maybe an antibiotic as well. And then at the bottom it says that we'll want to see them back in 7 to 10 days for reevaluation. And that is the discharge instructions. Okay, so what we have here is the previous vaccine history and all of our medical history in the computer for Charlie. What you can see me looking at now is the previous vaccine history, which we can just pull up the attachments for and open up so we can see what was done by somebody else. Other than that, she's only been here, so we have a whole bunch of history on her. And this is all of that. Okay, so we're just going to do some restraining right now. I'm going to do a dog muzzle, an e-collar, and then I'm going to do a physical examination of my dog here, Lacey. So to start, we're going to do some restraining for blood draws. So if we were to try and get blood from her jugular vein, we'd want her head up like that, and we'd want to make sure that we have good control of her legs, and the drawer would be able to draw from her neck there. For a cephalic, you'd want to have control of her head and then have the leg out for a cephalic. And then saphenous, we'd want them on their side. And we would want to grab that hind leg just like this so you can roll that vein, and it'll pop out for your drawer like that. Okay, next thing we're going to do is we're going to apply dog muzzle. So we've got my muzzle here. With Lacey it's going to be very easy, she's very nice, but a lot of times you'd have to kind of play a game with the dog, you know, just kind of get him to feel it, and straight onto her muzzle like that. And we clip it on, and she is properly muzzled. Next I'm going to apply an e-collar. This is for anybody, you know, who's messing with stitches or anything like that. So I've already got my gauze wrapped into the e-collar, so we're just going to go ahead and apply it to her. Really straight over her head. And then we're going to tie it in a knot that you can easily untie if it were to become, you know, tangled on something or something like that. So it's just a simple little tie like you would tie your shoes. Take that off. Okay, now I'm going to do an examination of our patient. Make sure that she's healthy enough to, you know, go under anesthesia. So stand up. So first of all, I'm going to get her temperature, and we're looking for anything below 103.5 first, and then nothing below probably 99, 98, 99. So we are right in her butt here. And she is at an even 100, so that is very good. I'm going to listen to her heart and lungs, and then I'm going to assess her an ASA grade. So we'll take a heart rate first on the left side. We're going to count for 15 seconds here. Okay, so I got 30 beats in that 15 seconds, so we multiply that by 4 and you get 120, which is a very good heart rate. And I didn't hear any problems with her heart or lungs, so I'm going to give her an ASA grade of 1. Alright, I'm going to go ahead and examine Jersey here. He's a cat. We're not actually doing anything to him today, but I'm going to get his temperature and listen to his heart and lungs just like we would for any kind of anesthetized procedure. So I'm going to start with his temperature. Good boy, Jersey. His temperature is 101. That's very good. Now I'm going to take a listen to him, and then we'll give him an ASA grade. Let's listen to your heart first, buddy. Yeah, good boy. So we got 40 beats in that 15 seconds, which gives us 160, which is good. It's not bad. And his ASA grade is a 1. He doesn't have anything wrong with him apparently. But yeah, he is doing very well. Okay, next we're going to properly get an animal out of a cage. So I've got Lacey in a cage here, top one. So what you're going to do is make sure that she doesn't jump out here, first of all. And then make sure that you have a nice firm grip on that back end. And you just pull her right out, just like that. I draw from Saphenous vein. I have a cat here. There's our blood. Alright, now we're going to do cephalic. Just one more try here.
Go ahead.
I'm going to go ahead and draw blood from the cat's cephalic vein here. So we've got Jersey and Miss Maria helping me. So let's go ahead and get some blood here.
You don't have to look. Oh, look away. Look away.
We've got a drop, so we are good. Alright, I'm going to go ahead and draw some blood from a cat. We're going to do jugular and
hello.
cephalic. Dr. Burke's going to restrain here. Tell me what you want me to do. Right here, okay. I'm going to go ahead and demonstrate how to draw blood from the jugular vein on a dog. Dr. Burke is going to assist me here. Use some alcohol. sterilize the area.
Alcohol is always good.
Alcohol is always good. Just like jugular. I'm going to pull some blood on a saphenous vein of a dog here. And draw blood from the cephalic vein of a dog. Okay, so now I'm going to discuss the minimum databases performed on a pet before we actually anesthetize them. So the minimum database for a young, healthy surgical candidate should include a packed cell volume, total solids, blood glucose, a BUN, and a alanine aminotransferase. These tests are considered a starting point, and if any of them are off by any means, a doctor may want to run more tests just to make sure that it's safe. Maybe doing a Chem 15 instead of a Chem 10, learning more, and maybe a CBC also. Appropriate anesthetic protocol. So when a patient is anesthetized and with the machine, the mask, you can always turn up the gas on them. The two main anesthetics we use are T-Dex and Propofol. Propofol is usually for older patients that may be more at risk to a problem while we have them anesthetized. So it's a lighter sedation, and we use more gas instead of the actual anesthetic being injected into their body. And T-Dex is more for younger dogs. It knocks them out a little more. Still very safe, but it's just not as light as a Propofol would be. I'm going to go ahead and fill out a controlled substance form here. This is for tramadol. It's obviously a copy of our original, but this is just for video. So I'm going to write down our patient's name here. So we got Booger Williams and the account number. Canine. This is for Dr. Bleem, Bernard Bleem, so B squared. Our previous balance is 741. That goes there. We're dispensing 10 of them, and then our new balance will be 731. Alright, so we're just going to go over the anesthesia machine real quick here. Right now we've got the non-rebreathing system hooked up, so we've got our bag here. The scavenging system hooks up to the back here, and then we've got the oxygen, which hooks up right here. So we'll take that off, and then we'll hook up the rebreathing system. Take that straight off. This is the rebreathing system. Hook it straight into there. And we can hook up a mask to it. So this is one way to knock out a patient. We've got our oxygen level, which is here. Always got to have that on, of course, right here. And then we've got this, which controls the ISO that's going into it. Looks like we're a little bit low right now, so I'll have to fill that up later. This is an induction chamber, which we use on cats a lot. So what we can do is hook this straight up to there, and we can get an induction that way with a cat directly in there. I'm going to demonstrate how to do a leak test. So we got to make sure that the pop-off valve is closed all the way. We've got our bag here. I'm going to cover this, the end of this, and I'm going to hit the flush valve button here until that inflates all the way, and we're going to make sure that nothing leaks out of there. Looks like nothing is coming out until I actually release this. so we don't have any leaks. Okay, I'm going to go over our Cardell machine here, and all the aspects of it. What we've got here is our CO2 reader. This monitors the inhalation and the exhalation of CO2. We've got our pulse oximeter here, measure the SpO2 or the oxygen in the blood. I've got it on his penis right now. I've got my ECG monitors here. That obviously monitors the heart rate. We do not have an esophageal stethoscope, which would go into the throat. It would measure the heart rate internally. We also have our thermometer here, which is in his butt. And let's see, this also measures the respiratory rate. This is my preceptor, Bernard Bleem. He's the managing DVM here, and he will be following me as I do some of these tasks. I'm going to go ahead and place an IV catheter on a dog here, and the cephalic vein. I already shaved, just got to prep it now. So let's get 3 rounds on here. The chlorhexidine and the alcohol prep. So, like I did for the saphenous vein, I'm going to go ahead and look for a flash of blood, and then we're going to advance the catheter. Put a cap in there. So I got my flash. I'm going to advance the catheter.
Adios. Hasta martes.
We're going to go ahead and tape it. Make sure it's nice and secure. And now we're going to give it a good flush, make sure that it's in. Maria, if you could put your finger there just to make sure that it's in. Okay, we're going to prepare this cat for his dental. We're going to do a saphenous catheter.
We have to do a saphenous video.
So I'm going to go ahead and shave down here. Clearly see that vein. We're going to prep it, our chlorhexidine and our alcohol 3 times. Okay, 3rd scrub is done, so let's place the IV. Dr. Burke is going to kindly hold off the vein. I'm going to stabilize it with my thumb. We're going to use a 22 gauge. We're going to look for a flash of blood. Right there, and then we're going to advance the catheter. Alright, so we got a nice flow, which means it's in. I'm going to put a cap on there. And then we're going to tape it. Make sure it's nice and secure. I'm going to go ahead and flush it just to make sure that this catheter is actually in. Burke, if you don't mind holding your finger there. Feel it?
Feels good.
Feels good. Alright, so right now we're going to do 3 kinds of injections. We're going to do intramuscular, intravenous, and subcutaneous. I'm going to show you on Lacey here. Subcutaneous is just taking a pinch of skin, then, yeah. Alright, intravenous, we're gonna have Megan restrain her here. We're gonna go for the cephalic vein. We're gonna want to make sure to pull back on the syringe to make sure that we're actually in the vein. And then we're gonna go ahead and give that. And then intramuscular, usually go for the back thigh here. Make sure you get into the actual muscle. Pull back to make sure you don't have any blood. And right on in. Alright, we're going to use CTX to anesthetize this patient. It's an intramuscular injection, so we're going to go ahead and find a muscle, go straight in, pull out, make sure there's no blood, and right in. I'm going to place an endotracheal tube on our sedated patient here. So Dr. Williams is going to grab her mouth, grab her tongue, and we're going to move the epiglottis out of the way here. We're going to shoot right in between the two retinoids. And in we go. Coughing is usually a good sign that it's in. Yeah, that's it. Alright, we're going to tie that back here. And then we're going to inflate the cuff with our syringe here. And we are going to push until I have a little bit of resistance in the syringe. Just like that. I'm going to go ahead and apply some artificial tears to her eyes to lubricate them.
It's not done.
I'm going to go ahead and prep this patient for surgery today. She's getting spayed. So I'm going to go ahead and shave her abdomen area here. And then we're going to use chlorhexidine and alcohol prep. And I'm going to make sure to go from the inside out in a circular motion. Once I'm done shaving here. So that's good on the shaving. So I'm going to palpate the bladder first, feel if she needs to be expressed or not. And it does not need to be expressed, very, very small. So doesn't need to be expressed, so now we're going to go ahead and prep. Go all the way around in a circular motion. And make sure to do this 3 times.
No, they're refill, like, yeah, you have one.
Now I'm going to take her over to the surgery table. Make sure not to touch that area. So I'm monitoring this patient during his dental procedure. What we've got here is we've got the heart rate, which is 124. It's a very good heart rate. We've got the temperature. It's 1013. It's very good. We've got a blood pressure, which is low. The cuff is not hooked up totally 100% properly. This is an SpO2 reading. 100% is very good. We've got a respiratory rate, and we've got our CO2 level also. This is my fake dog, Sparky. I'm going to perform CPR on him, show you how to do it. So you want to do 30 compressions. Now on a small dog, you can put your hand underneath and do 30 compressions like this. On a bigger dog, you can use both hands and do 30 compressions for every 2 breaths. So you do 30 compressions, and then if they're intubated, you can use the ambu bag, and you do 2 breaths for them that way. Or if you're doing it by yourself, 2 breaths this way. So you would do 30 compressions to the song Staying Alive by the Bee Gees. So staying alive, staying alive, scrub up like I'm going into surgery here. So I'm going to go ahead and get all the surfaces of each fingers, and then underneath the nail eventually here. Usually do this for about 10 minutes. And you gotta get all up on the arm as well.
My gosh.
All the way up to your elbow. Rinse. Dry my hands. And we'll get my gown on here. Alright, I'm going to go and put on my gloves now. Open glove method here. Alright, now I'm all gloved and ready to go. So while sterile, a surgical assistant would hand instruments to the doctor that would need them, maybe assist in holding some area of the patient. Once sterility is broken, let's say on like a glove is broken, I have to start all over as far as getting sterile again. And then as far as surgical instruments go, if that hits the floor, no longer sterile, cannot use it, it's done. Properly show you how to clean the surgical area / room. So I'm going to go ahead and spray down our surgical table with our disinfectant and spray underneath. And we're going to let that sit for a little bit while we sweep the floor. Then after we sweep the floor, spray the floor with our disinfectant, and we'll let that sit for just a good 5-10 minutes, and then we will mop. Alright, so I've let my disinfectant sit on the table and on the floor for about 10 minutes now, so I'm going to go ahead and wipe up the table and the tray underneath. Mop up the I'm going to demonstrate how to properly clean our instruments here. They've been sitting in the cleaner for about 15 minutes now. So we're going to go ahead and scrub it with our little scrubber here. Make sure we get all aspects of the instrument. And then we're going to put it into the lube for another 10. I'm going to go ahead and pack. This is a neuter pack. So we started off with the towel. We've got our gauze, our needle and our needle holder. We've got scissors. We've got our needle holder. These bad boys. We'll put these right on the side. We're going to put these right on the side also. We're going to wrap it. I've got my little strip to indicate that the pack is sterile on the inside. That goes right on top. We'll put our other drape and our other towel. And we're going to wrap it as tight as we can. That way first. Second level of draping. And then we're going to indicator tape right on top. We're going to mark it with my initials and the name of the pack and the date it was done. Alright, I'm going to go ahead and fold up this surgery gown. I'm going to take the sides here, fold it to the middle. The arms into the middle. To the middle one more time. Reach it up. And then we got to do an accordion here. And we are all set to wrap it. Alright, I've got my indicator strip. I'm going to put that right on top, and then we're just going to wrap this up here. Down. We want to wrap it as tightly as possible. Our second mirror here. Alright, we've got our indicator tape, which will have my initials, what the pack is, the gown, and the date. Alright, so I'm going to run an autoclave cycle here. Got my pack not sterilized. Put that in there. We're going to run the water here. Fill this. Fill water until we see it down at this little crack here. So we've made it down there. I'm going to close her up. We're going to run it for 25 minutes under the sterilized section. 5 minutes at 273 degrees Fahrenheit. And we usually, this is the pressure gauge here, we're going to get up to about 274 here. I'm going to demonstrate how to properly pack the autoclave. You want to make sure that they're not stacked on top of each other. So you've got one in there on top there. We'll go right in behind it, and you can throw in smaller packs on top, but you don't want to stack up like 2 spade packs on top of each other. I'm going to go over how to maintain the autoclave, so we're going to go over how to clean it here. This is the cleaner that we've got. So what you're going to do is you're going to mix 6 ounces of it with 64 ounces of distilled water. You're going to drain the reservoir and fill with a cleaning solution. You're going to run a normal cycle, and then instruments should not be in there while you're doing it. Drain the cleaning solution from the autoclave and the reservoir. Rinse thoroughly until water runs clear, and then you run the reservoir again. Drain, rinse solution, remove the tray, rest and wipe out inside of boiler and tray rest. And that's it. I'm going to show you how you ensure sterility in the packs. So we've got the indicator tape on top, which has the lines when it's sterile, and then inside of the actual pack we've got this strip, and this line will turn black if all the items in the pack are actually sterile. Alright, I'm going to go ahead and remove a staple from Lacey here. So as you can see, it's down here. And we're just going to take our staple remover, get in there, and pull it out.